Hi everyone, my name is Theo and I will be giving my presentation on amyotrophic lateral sclerosis. I hope you enjoy. So what is it? It's ALS. So ALS is commonly known as Lou Gehrig's disease, which was named after a famous New York Yankees baseball player who was diagnosed with ALS in 1939. The name amyotrophic is Greek for no muscle nourishment, while lateral sclerosis means scarring of the spinal cord. ALS is a progressive and fatal neurodegenerative disease that attacks the upper and lower motor neurons in the primary motor cortex, brainstem, and spinal cord. Well, with the motor pathways compromised, the central nervous system can no longer communicate with the muscles, and this causes individuals to experience a gradual loss of voluntary muscle movements. ALS is also phenotypically classified as either limb or bulbar onset, with the former referring to symptoms exclusively appearing in the arms and legs, while the latter manifests itself through difficulties in speech and swallowing. So types of ALS, there are three types. Sporadic ALS is the most common. It has no identifiable cause and is found in 95% of cases. Familial or genetic ALS occurs in 5 to 10% of cases and is often due to individuals inheriting a faulty gene. Lastly, Guamanian ALS corresponds to a high incidence of ALS found in Guam. So this is super interesting. Studies have shown it may be due to them consuming a neurotoxic non-protein amino acid found in the seeds of a plant known as a cycad, which is common among these regions. Fruit bats feed on cycad seeds, which also happen to be a delicacy eaten by many of the locals. So researchers believe that consuming this species of bat results in an accumulation of the neurotoxin, thus predisposing the individuals to ALS. So while it's very rare, ALS has been increasing in prevalence. So it affects around 4 to 8 individuals per 100,000. It's 20% more common in males, and 93% of cases involve Caucasians, making them the highest ethnicity at the highest risk of developing ALS. The average life expectancy of a person with the disease is around 2 to 5 years, but 10% can live longer than 10 years. The rate of progression between early, middle, and advanced stages of the disease varies immensely between individuals. In early stages of ALS, however, muscles do become weak and stiff, with individuals often developing an abnormal gait, slurred speech, poor grip and balance, and difficulty performing fine motor movements. Often in the middle stages, individuals experience reduced mobility and a loss in functional independence, affecting their ability to perform activities of daily living, such as eating or dressing themselves. People can also show unregulated emotions with episodes of uncontrollable laughing and crying, and this is known as the pseudobulbar effect. As the disease does progress, there is widespread muscle rigidity and paralysis, causing individuals to lose their full ability to speak, eat, move, and breathe. Many also experience excessive drooling as well as weight loss at this stage. And once they do reach that end stage, respiratory failure is typically the leading cause of death. Well, what is super interesting is that most individuals still retain excellent cognition. So while physically unable to express their thoughts, they're able to still perform complex mental tasks that require high levels of reasoning and problem solving. So to date, the etiology is, while complex, it is unknown, and a variety of causes, though, have been proposed. So a study in 1993 linked the genetic mutation of the superoxide dismutase enzyme, SOD1, with the development of familial ALS. So research suggests that this mutated gene can trigger the overproduction of free radicals, which places the body under enormous amount of oxidative stress and lead to cell injury and death. Since then, over 12 other genetic mutations have been associated with ALS. Glutamate-induced excitotoxicity has also been suggested as a possible cause, as individuals with ALS have particularly high levels of glutamate in their body. Glutamate is the primary excitatory neurotransmitter, which binds to specific postsynaptic receptors in the central nervous system. So overactivation of these receptors by glutamate has been found to be toxic to nerve cells and induce neurodegeneration. There's also been evidence suggesting that there is an immunoinflammatory aspect in ALS development. Individuals with ALS have defective and low numbers of T regulatory lymphocytes, especially as the disease progresses. So this is associated with an increased microglia activation, which promotes neuroinflammation, a key hallmark of ALS. Researchers also believe that a decrease in these T reg lymphocytes reduces their immunosuppressive qualities and ability to maintain self-tolerance, which may mean that an autoimmune response may be implicated in ALS, although the exact trigger is unknown. Research has studied exposure to environmental toxins as a cause of ALS as well, after military veterans during the 1991 Gulf War reported very high rates of the disease. So exposure to various agricultural chemicals, electromagnetic waves, and metals like lead cause oxidative damage to DNA and neurons, and as such have been linked to ALS. Smoking has also been associated with the high risk, and this is due to the neurotoxins found in cigarettes. Other possible factors do include structural and functional abnormalities in the mitochondria, dysfunctional sodium potassium ion pumps, autophagy, and reduced secretion of neurotrophic factors and neurotoxic mediators. So treatment, while ALS is not curable and cannot be reversed, treatment options do exist that focus on managing symptoms and providing supportive care through individualized rehabilitation. There are only two pharmaceutical drugs to date that have been FDA approved to treat ALS. Riluzole is an anti-glutamatergic agent, and its mechanism of action, while unknown, it is believed to inhibit glutamate release. And studies have shown that it can modestly slow disease progression and prolong survival by about 3 months. Edaravone, on the other hand, is a powerful antioxidant agent and presumed to reduce oxidative stress and injury. Research shows it inhibits motor deterioration and can allow individuals in the early stages of ALS to maintain their function for longer. Some medical interventions also exist to treat respiratory insufficiency and prevent malnutrition in people at advanced stages of ALS. These include a tracheostomy, which creates an opening in the trachea to provide an alternate airway for breathing, and a percutaneous endoscopic gastrostomy, which inserts a feeding tube into the stomach. Patients with ALS also require multidisciplinary care from a variety of specialists and therapists. So nutrition counseling can help individuals still obtain proper nutrition by providing easy to swallow dietary alternatives. Speech therapy and communication training can benefit individuals with ALS to learn new adaptive skills and techniques to make their speech more intelligible. However, assistive devices may be needed once individuals can no longer communicate verbally, which may include, which can be through computer-based speech synthesizers or TTY telephone relay systems. And physical and occupational therapists can provide instruction on how to use specialized equipment such as customized wheelchairs, walkers, braces to maintain mobility, maximize independence, and overall improve quality of life. There have been other treatment strategies involving gene, antibody, and stem cell-based therapies, and those are currently underway and do seem promising from the research that I read. So. Effects of ALS on physical activity. ALS can have various impacts on physical activity. Studies have shown that there is a marked decrease in activity level in people with ALS. This may be due to personal factors personal barriers such as fatigue, muscle weakness, and respiratory problems related to their own condition, as well as limited transportation and caregiver burden, which may limit their access to physical therapy. People with motor neuron disease that have impaired mobility found participation in community-based activities like sport to be most challenging. This was attributed to inaccessible buildings, stigma, a lack of awareness of disabilities by the general public, or also a lack of confidence originating from a perceived lack of support in using mobility aids. A Canada survey also revealed that 31% of physicians in ALS clinics do not feel competent or confident enough to prescribe exercise to patients with ALS, which is insane. With 22% attributing this to the lack of exercise, to the lack of evidence regarding the benefit of exercise for this group. And lastly, individuals with ALS also have certain physiological constraints that increase their exercise intolerance and reduce exercise capacity. So studies show that they reach anaerobic threshold much sooner and have reduced muscle performance due to a loss of muscle bulk. They also have an impaired oxidative metabolism and dysfunctional mitochondria that leads to their body producing much less ATP. Research shows that exercise has very important benefits for people with ALS. One study found that aerobic exercise significantly reduced motor deterioration and had a positive effect on functional decline. However, it did not improve the strength of muscles already weakened. Another study showed that exercise prevents additional muscle atrophy from lack of muscle use and is most important in the early stages of ALS. So exercise recommendations, there are currently no ALS-specific guidelines in regards to physical activity. However, most studies do suggest moderate intensity and low resistance exercises. Exercise programs are recommended to include flexibility, strengthening, aerobic, and balance exercises. Flexibility exercises should include regular, slow, and rhythmic stretching, and range of motion exercises performed daily for about 20 minutes. Balance exercises should be done daily as well and include 3 sets of 10 reps of core stability exercises. Aerobic exercises should be done at a moderate to maximal level 2 to 3 times a week. Swimming has been said to be ideal for individuals with ALS as it minimizes biomechanical stress on muscles and reduces risk of injuries. when performing strengthening exercises. This is super, super important. Individuals should stick exclusively to low weights and exercise at a rate of perceived exertion of around 5. So special concerns, muscles can be easily overworked in this group because they are already functioning near maximal limits. So individuals must be careful to avoid overexertion and pushing themselves past the point of fatigue. Individuals with ALS also have poor balance and are at an increased risk of falling, so must be encouraged to hold on to stable support and choose a type of exercise with low risk of injury from falling. Most importantly, the shoulders in people with ALS are prone to joint tightness and pain and may be at risk of becoming frozen from immobility, a condition known as adhesive capsulitis or frozen shoulder. As such, it's recommended they do stay hydrated and do a little light warm up and cool down before attempting any physical activity. So exercise precautions, individuals with ALS must exercise in moderation and precautions must be taken to avoid overtraining and exercise fatigue. Firstly, individuals should consult with a physician prior to attempting any exercise program to ensure it's fully safe. Most importantly, they should not exceed their body limits. So exercises should be done under supervision and performed slowly and smoothly with rest breaks taken at the individual's discretion. There must be frequent monitoring for signs of overexertion, such as prolonged exercise fatigue, muscle pain, soreness. So if the individual experiences any of these signs, then it's advised that they stop the physical activity immediately. According to the Muscular Dystrophy Association, individuals with ALS must avoid eccentric, highly repetitive, and heavy resistance exercises, as they can cause permanent loss of strength in muscles that are already weakened. They should also avoid exercising in extreme temperatures, such as swimming in cold water, as this can cause muscle cramps and premature fatigue. They also must avoid moving any limb past the point of pain or resistance. And lastly, some things to remember. So there are a few things that we can take away when exercising with individuals with ALS, and that's that exercising should be done in a climate-controlled environment with careful supervision, so fatigue can be monitored appropriately. Individuals must also be mindful that exercise programs may need to be modified as the disease progresses, and any type of exercise should be progressed slowly and first attempted at a low intensity, duration, and frequency. If a person does experience fatigue or pain for longer than 30 minutes after exercise, the program must be reduced or modified. And gentle and slow assistance should only be provided once exercises cannot be performed independently. Lastly, when designing a strengthening or aerobic exercise program for a person with ALS, one must find a balance between preventing overtraining, but promoting enough moderate activity to prevent muscles from additionally atrophying from lack of use. So, and these are my references, and I hope you guys enjoyed, and thanks for watching and listening.